Okay, hello.
Hello.
Thank you so much for taking the time to join us today.
My pleasure.
We're really excited
Thank
to
you for having
learn
me.
from your experiences. Yeah. To begin, could you please introduce yourself by sharing your name and your current role in the organization you work with?
My name is Ben Park, no relation to Scarlett Park. I am the director of the Vanderbilt Ingram Cancer Center since 2022.
So, first question, could you describe your career journey and what first inspired you to pursue both medicine and research?
Yeah, so my career is kind of similar to what I liken to cancer. I give this talk to undergrads a lot where I explain cancer is really a disease of DNA gone bad. We have a normal cell and a cancer cell, and it doesn't just flip a switch and happen overnight. What ends up happening is you get a mistake in DNA, and that gets kind of propagated in progeny cell. We call that clonal evolution. And then amongst those, another mistake happens. And it takes about 3 to 8 mistakes to go all the way from a normal cell to a cancer cell. And I use the analogy because I'm an identical twin. I like to say I cloned myself once in utero. And it's an interesting genetics experiment, but I don't know if I'm the experimental or the control arm. So my twin brother and I were the same until college. We both went to University of Chicago. And then I started getting interested in medicine, and he went into business. And he is now a retired ex-business person, so he was clearly the smarter one. But I ended up working in a lab because that was a checkbox or a prerequisite for applying to medical school. And that's when I first learned about what biomedical research and cancer research really was. My boss was a tumor immunologist, and he's 80 years old. He still is going strong at the University of Chicago doing great work. And it just dawned upon me, it's like, wow, how cool is this? We could try to figure out using guesses, we like to call them hypotheses instead of guesses, that we could try to trick our immune system to attack our cancer cells and not ourselves. And it just made so much sense. But then I also learned about MD PhDs. My boss was an MD PhD. We had all these trainees in the lab that were either MD PhDs themselves or on a MD PhD program or in an MD PhD program at the University of Chicago. And so I just thought, this is amazing that you can get both. And many big biomedical research institutes with schools of medicine like Vanderbilt and the University of Chicago and where I went to the University of Pennsylvania have these programs where they actually pay for you to go to medical school and graduate school, and you even get a monthly stipend. So I thought I gotta try to get one of these. Unfortunately, I went to Penn, got in their MD PhD program, trained in oncology, and the rest is kind of history. And I've been a breast cancer, what we call physician scientist ever since.
So you've worked, as you just mentioned, in some of the nation's top institutes and now led important programs at Vanderbilt. So what experiences along the way most influenced your passion for it?
You know, I have had a lot of personal history with cancer patients. My ex-wife's grandmother, I think that's my ex-grandmother-in-law, developed metastatic breast cancer when I was training as an oncologist back in 1997, 98. And, you know, it really occurred to me how much we needed help. It also occurred to me how we have to be sensitive to patients' wishes and their emotional state. You know, she once looked at me and her body was being ravaged by chemotherapy and said, Ben, do I have to keep taking chemotherapy? And that really broke my heart, and it made me realize that as an oncologist, we have to sometimes, you know, our job is not just to give therapies and try to make people live longer. Our job is to actually help people live longer, but also better. And that is a huge mental aspect, I think, of oncology that really influenced my decision to do this.
Yeah. So you just mentioned how, like, cancer treatment is not only physically demanding, you said, but also mentally and emotionally.
Yeah.
So from your perspective, what are the most biggest emotional struggles patients face during this treatment?
Yeah, you know, for breast cancer patients, because most breast cancer patients, believe it or not, are actually going to be cured in this country because of early screening. A lot of people don't recognize that. But I often tell patients, in fact, I always tell patients the first time I meet them, when they have a new diagnosis, that it's usually not going to be the surgery, the radiation, the chemotherapy, and all the other therapies we give. That's the toughest part. It's usually afterwards, where patients don't know whether they're cured or not, and they sit in the middle of the night wondering, is this going to come back, and am I going to die from it? Because if it comes back as metastatic disease, it's not curable anymore. That's a huge burden to shoulder.
Yeah.
And I think for many patients that they really struggle with that, as do their families and their caregivers.
Yeah. So families can often carry a huge part of that burden when their loved one is sick. So what have you observed about how cancer impacts families, and like how can we better support them through the journey?
Yeah, I like to think that everyone is a little bit different, but the majority of patients with cancer are going to need some sort of mental help, mental health help, I should say, because it is a big, big thing when you're looking at your own mortality in the mirror, where you don't know whether or not you're going to be here in 5 to 10 years, when you don't know whether or not you're going to see your kids grow up and your kids have children. That is something that has really resonated with me now that I've gotten older and have adult children. And so I think that the hard part about this is to really try to develop survivorship programs, which are pretty standard now, especially for breast cancer, but to really help people who need the help get the help they need. And that has been a big, big component of what we do here at Vanderbilt Newham Cancer Center.
Yeah. Do you hope to see any more improvements in that, or do you think it's like what's going on right now is fully fine?
Oh, no, there has to be more improvements in this. I think a big part of this is the lack of awareness of how big a battle mental health can be for cancer patients. And then I think also not knowing that we have resources to help them. And we need to do a better job with our communities, with our patients, to let them know we have resources, we have programs that can help them get over the mental battle. I've often said to patients, we can cure your cancer, but if we don't actually help you get your life back mentally, I don't think we've actually done much for you.
Right. So you've been very active in fundraising and awareness efforts. So what motivates you to connect your research and clinical work with public advocacy? And how do these events that you do raise awareness about the mental and emotional side of cancer care?
Yeah, I think public awareness and advocacy are things that go hand in hand with both cancer research and being a cancer care provider, or in my case, a healthcare provider. I think the advocacy really, I think, is to let people know that, one, they're not alone, that we have great resources here because we are an NCI designated comprehensive cancer center and really the only one in the state of Tennessee that treats both children and adults, and to let really everyone know that our mission is to what I call democratize healthcare, and particularly cancer care. And by that, I don't mean that everyone gets the same thing, but that every individual, we try to craft a plan for them based upon their genetic background, based upon their tumor genetics and the genetic alterations that I mentioned earlier, but also based upon their own individual mental health needs and the needs of their care providers and their families. This is the complete picture, and people need to know that cancer isn't just going to the doctor and getting chemotherapy, which is, I think, superficially a lot of people think it is.
It is. So for students, especially like young people who may have a family member going through cancer treatment, what advice would you give them about navigating through that difficult time?
I think,
what's the first step you can take?
Yeah, I think the first step is knowledge. Knowledge is power, and to really try to do some homework. We have, this wonderful thing called the internet now, which didn't exist when I was in high school. But it allows us to really tap into the resources and wealth of information that I think students can really start to do some research and homework on. Hey, what does it mean to have breast cancer as opposed to pancreas cancer? They're very different, and the outcomes are different, and the prognoses are different. The treatments are different. So I think, again, individualizing every patient with what they have, what they don't have, what are their needs, and every individual is different. Some will need more help with the mental struggles. I've had some patients who don't need any.
Yeah.
Everyone's different, and everyone's home situation is different. So I would tell students, do your homework, figure out what it is that are the unmet needs for your loved one with a diagnosis of cancer, and then try to reach out and come to the experts, come to your local NCI designated cancer center, get information, get help. We have the resources, we have the programs, and we welcome any type of community interaction and engagement.
Yeah, thank you for your piece of wisdom. So for the last question, if you could leave today's listeners with one key message about supporting cancer patients, which you just briefly talked about, what would it be?
I think the number one thing is, again, to think about everyone as having their own individualized healthcare plan for cancer. I think, our motto here for the medical center as a whole is really personalized healthcare. And I feel like that really is an extension into cancer care as well. even if you're an identical twin like me, we're all different.
Right.
And I feel like that we have to remember that about individuals with cancer, that it's not a one-size-fits-all.
Yeah.
Even though standard of care therapies may say you should do this and that and the other, one of the other things that I've said in the past is coming to a big cancer center to get a second opinion, to see what clinical trials and research may be available, because that's always a great option too. Studies have really shown patients on average do better on clinical trials. Yeah. So I think that that's another area where, again, knowledge is power. Do your homework. Reach out to us, to anyone, and try to get as much information, and then really use that as a foundation for helping out the patients with cancer.
Yeah, thank you so much.
Thank you.
Thank you so much for sharing and sharing your time and insights for us today. And we really appreciate the work you've been doing for research and reminding us of how important it is to know about it, even if we are not pursuing medical careers. So yeah, it's been an honor just speaking with you. So thank you so much.
It's been a complete privilege and honor being here, and thank you for inviting me.
Yeah, thank you.
And why aren't you going to medicine?